Women, unfortunately, die of heart attacks more often than men because we don't even realize we're having a heart attack. So I'm meeting my friend, Dr. Shola.
How are you, darling?
I'm so excited. She's an internist, and she takes care of a whole lot of patients with a lot of heart problems. So she is the perfect person to discuss heart health with today. First of all, I know one of the biggest things is women don't even realize that they're having any kind of cardiac event. Can you tell us what are the signs in a woman of a heart attack?
Okay, so apart from the crushing chest pain that people describe, feels like an elephant is sitting on my chest, which usually can radiate to the chin, the jaw, the arm, we have subtle signs. So shortness of breath, undue shortness of breath, where last week you walked 3 blocks, today you get short of breath going to the bathroom. You sweating, just pouring the sweat is not a hot flash, and in combination with fatigue, these should give people a pause and think, oh, I could be having a heart attack.
So why do you think we as women just ignore the signs that something is very obviously wrong with us?
Because the signs in women can be subtle, you just, blow it off and think it's not serious. As women, we do need to do a better job in taking care of ourselves.
So it was great for her to give us some signs and symptoms to look out for. We blow it off as indigestion or, oh, that was just a hot flash, but when in actuality, we're actually experiencing a heart attack at that moment.
African Americans actually have the highest rates of hypertension in the world. African American women, we have higher rates of hypertension, diabetes, and obesity. These are all things that predispose to heart disease and heart attacks.
Don't you think diet has a lot to do with it?
Diet definitely is to blame. Another thing is that we're more salt sensitive than other people. So, someone else could eat a certain amount of salt and be fine. We eat the same amount of salt, blood pressure's in the sky.
The biggest surprise to me was to find out that salt, the same amount of salt that someone else would eat, an African American will eat, and it will have a larger effect on them. So that was something I had no idea about. What can we do to prevent? We don't want to have a stroke. We don't want to have a heart attack.
Take care of your body, whatever form that takes. So you exercise, you eat right. You go to the doctor at least once a year if you have no health problems. Like I said, if you keep taking care of your body, as conditions arise, you and your doctor working together will be able to nip these things in the bud.
Thank you for all this wonderful information.
You're most welcome.
But, we're on a basketball court, so I guess we should probably make use of this and get in a little more exercise. I had a great time with Dr. Shola today. We actually played basketball today. It was not really my thing, but I did it anyway for our good heart health.
Yay!